Hey, today we're going to talk about a big new study helping us out in the British Medical Journal. You're going to love it. We'll talk about spinal surgeons against spinal surgery. Super interesting. And we'll talk about manual therapy in pediatrics. It's under attack, y'all. Now, that's a big topic, so especially down in Australia. But first, let's get ready to shake your tail feathers. Here's that bumper music. And we are back. Welcome to the podcast today. I'm Dr. Jeff Williams. I'm your host for the Chiropractic Forward podcast. You have done the mashed potato right into episode number 68, just like we were back in the 1950s. Sometimes I wonder, maybe I was born in the wrong generation. Seriously. But speaking of that, if you'd like to hear what we listen to in my office all day, every day, go to Spotify and get my old new Memphis Motown Too playlist. My profile is amarillo, P-A-C-C. That's amarillo, platypus, absinthe, crustacean crap time. So you're welcome. I'm here all week. Tip your waitresses, please. Thank you. Now, we're here to advocate for chiropractic while we also make your life just a little bit easier. Part of that is having the right patient education tools in your office, tools that educate based on solid researched information. And we offer you that. We've done it. It's already done. So we're taking pre-orders right now for our brand new evidence-based office brochures available at chiropracticforward.com. Be one of the first to own them. Just click the store link at the top right of the homepage and you'll be off and running. Just shoot me an email at dr.williams@chiropracticforward.com if you think something's out of sorts or it isn't working correctly. We're working right now to fix the shipping and handling function through FedEx, so just stick with me. If you're like me, you get tired of answering the same old questions. Well, these brochures make great ways of educating while saving yourself time and breath. They're also great for putting them into the take-home folders for your new patients. So go check them out, chiropracticforward.com, right under the store link. While you're there, sign up for the newsletter, won't you? It's just a damn email. I promise I'm not going to spam you. One email a week, let you know when the new episode goes live. And that's it. So, DACO, let's talk a little bit about the DACO, Diplomat of the Academy of Chiropractic Orthopedists program. I went on a short little spring break vacay last week to Oklahoma City. It was really nice, by the way. We had a blast. If you're anywhere near Oklahoma City, but you haven't been in a while, you ought to go. They got good stuff going on in that city. So because I went on a little spring vacay, I didn't get many hours. I got like 3 hours, I think, which is kind of depressing, but it's okay. The class I took was the third class in the Pain in the Frame series, which is fascinating, and it was over chronic shoulder pain. And I have to tell you that the neurology is not something that comes naturally to me. But in the same breath, I want you to also know that it's presented in a way that is finally understandable, even by me, when it comes to hardcore neuro topics. And that's saying a lot, y'all. Seriously. And the concept is repeated repeatedly. So that sounds redundant, and I'm aware of that. But I feel like you're probably picking up what I'm throwing down. So I got to tell you, Dr. Anthony Nicholson, who is part of the team that has set up the educational program, and is also going to be a guest in the I think next weekend, but very near future. He's going to be with us here on the podcast. He was a neuro diplomat before getting his DACO, so there is plenty of neuro in the course, but don't let that scare you away. Had I known that going in, it probably would have scared me a touch, but it's no biggie. It's explained very well. And though I didn't completely grasp it the first time or two it was run by me, I got it by the 10th time. I'm telling you, it is such good stuff. I'm a slow learner, I beat myself up. I'm almost done with the whole thing, though, and I'm going to give myself a little bit of props. I have a 95 in the class, so trust me, I'm not a neuro guy. I cannot say that enough. I hate hardcore neuro, but it's excellent stuff that you need to know. And I promise you, if I can do it, you can absolutely do it. So be looking out for that interview with Dr. Nicholson all the way from Australia in just a couple of weeks or so, maybe sooner. He is absolutely fascinating. Now, if you hear something here you really like and you'd like it in a written form rather than spoken, just hop on to chiropracticforward.com, find the episode, and just scroll down to copy and paste it. If you're using it for content on your website for some reason, just be cool and give us some credit, won't you? I'd sure appreciate it, and I know that the researchers that we cover would absolutely appreciate it too. Also, we started a YouTube channel. It's Chiropractic Forward YouTube channel, where we just take the audio from these and we upload it as a video form, so you can watch it, listen to it on YouTube that way. So, item number 1, onward we march. This is a biggie. It's brand new. It's called Benefits and Harms of Spinal Manipulative Therapy for the Treatment of Chronic Low Back Pain, Systematic Review and Meta-Analysis of Randomized Controlled Trials, and authored by Sidney Rubenstein, Anne-Marie de Zoty, Marienke van Middelkoop, and I heard of other very difficult names. It was published in the British Medical Journal on March 13th of this year. So,
hot stuff coming up.
The first thing I'll say here is that there's a pyramid of research hierarchy out there. I'll post it in the show notes at chiropracticforward.com, episode number 68. Go check it out. If you look at it, you're going to see that randomized controlled trials and systematic reviews, meta-analyses, those studies are at the very tippy-toppy of the hierarchy. Well, this paper, for example, as the title says, is a systematic review and meta-analysis of randomized controlled trials. Are you smelling what I don't know. Do you see what I'm saying here? That's why it's a biggie. They wanted to assess the benefits and harms of spinal manipulative therapy for the treatment of chronic low back pain. Low back pain. They get all the attention, right? We're not done with low back pain research, evidently. I think it's kind of exhausted, but that's okay. I'm still waiting to see those cervical pain studies rolling through, but anywho, they did a systematic review on 47 randomized controlled trials, including 9,211 participants. That's great, man. That's a good sample size. And they all examined the effect of spinal manipulation or mobilization in adults over 18 years old with chronic low back pain, with or without referred pain. They did not accept the studies that looked at sciatica exclusively. And here's what they found. They found moderate quality evidence suggests that spinal manipulative therapy has easy for you to say. Let's start that over. Moderate quality evidence suggests that spinal manipulative therapy has similar effects to other recommended therapies for short-term pain relief. I went searching for what are these other recommended therapies, but I couldn't find it. They didn't line that out real clearly in the body of the paper. So, all we know is moderate quality evidence that spinal manipulative therapy has similar effects to other recommended therapies for short-term pain relief. Now, the same quality evidence suggests a small, clinically better improvement in function. High-quality evidence suggested that compared with non-recommended therapies, which I don't know what those are, spinal manipulative therapy results in small, not clinically better effects for short-term pain relief and small to moderate clinically better improvement in function. And they say about half of the studies examined adverse and serious adverse events. They say most of the observed adverse events were musculoskeletal related, transient in nature, and of mild to moderate severity, which we knew. They concluded spinal manipulative, this is a quote, spinal manipulative therapy produces similar effects to recommended therapies for chronic low back pain, whereas spinal manipulative therapy seems to be better than non-recommended interventions for improvement in function in the short term. Clinicians should inform their patients of the potential risk of adverse events associated with it. So I have to say, when we dive in a bit deeper and we kind of read beyond the abstract, while the study shines pretty brightly on spinal manipulative therapy and its practitioners, we as chiropractors cannot lean on this thing completely for the good or the bad. And that's because of the 47 randomized controlled trials accepted, chiropractors were the practitioners that delivered the manipulative therapy in only 16 of them. 14 were delivered by PTs, which smokes my gears. 6 by a medical manipulator, whatever the hell that is. What is a medical manipulator? 5 by a DO, 2 by a bone setter. How do you get a degree in bone setter? I didn't even know that was a real thing. I've heard the term, but it just sounds ridiculous. And so, I don't know. Moving on. Just keep that stuff in mind. This isn't fully representative of what chiropractors can do and how effective we can be, but it's a good start. Also, the techniques used in the 47 studies ranged from high velocity, low amplitude, like a diversified adjustment, to low velocity, low amplitude, passive movement techniques, or a combination of both of those. Now, most of us probably use high velocity, low amplitude. So again, not entirely representative of what we chiropractors that move the bones do, at least in my opinion. And what they say down deeper in the paper, they say that considering recent systematic reviews and information showing that manipulative therapy and massage should be considered a cost-effective option for low back pain, and then we have this study showing the effectiveness. Basically, what they're saying, what I'm saying is, what are we waiting for to get this thing rocking and rolling? You know? Okay, that wasn't their words exactly, but, that was me. I added that. But I said it based on their research speak, because researchers, they're not always cool, assuming I'm cool, but I'm not really. I'm including an infographic that the authors generated on this that kind of cuts to the chase on their findings. Maybe something you can use for your waiting room. So go check it out in the show notes. Great paper, very impactful, and it most importantly supersedes the recommendations that you heard us talking about from the Lancet Medical Journal back in episodes number 16, 17, and 18 of this podcast. So if you like this stuff, go revisit 16, 17, and 18. I've said it so many times, and it remains a truth. Considering the forces and powers that have been against us for generations, if we were inherently wrong in what we do, we would have been wiped off the face of the planet years ago. Bye-bye, Earth. Yet, we persist. We're here. It's my opinion that we don't persist because of creative sales techniques, influential legislation, and millions and billions in lobbying efforts. God knows chiropractors don't have billions. I think that we persist and we're still here because we are right in what we do on the most basic levels. So our second item this week is an interesting article I came across, and it was on painchats.com. It was called, "This Spine Surgeon Says Avoid Spinal Surgery for Low Back Pain. Stop and think carefully about back surgery." So obviously that got my attention. You probably saw me share it on the Chiropractic Forward Facebook page because lots of people have gone and shared that post and that article. It was written by Dr. David Hanscom, Hanscom, MD, and I've got it linked in the show notes, episode 68, chiropracticforward.com. Now, His actual website is backincontrol.com, but this article was on painchats.com. The article starts off with this, quote, "If you're considering having spinal surgery as the final fix for your back pain, I'd like to help you to think again about your options. I'm a spinal surgeon, and I want you to know that surgery is not your best option for recovery from low back pain. Surgery for relieving back pain has never been shown to be effective in a stringent research study. The most careful research paper published in 2006 demonstrated that only 22% of patients were satisfied with the outcomes 2 years later. Essentially, all research shows consistently poor outcomes for fusion surgery performed for back pain." End quote. And all I have to say is hallelujah. We are going to look back at x-rays of fusion surgeries in probably 10 to 15 years, and we're going to wonder what in the hell were the surgeons thinking. Mark my words right here on this day on this podcast. In fact, surgeons themselves are going to look at these x-rays and going, what the hell were we thinking? So this surgeon here, Dr. Haskell, he breaks it down into reasons. So I'm going to shorten the article, but please go read the whole thing. It's really good, and it makes so much sense. It's so much sense that I went and bought his book, and I'm reading it right now, and it is making a ton of sense. So reason number one, he says, fusion surgery doesn't help pain. And I love everything about this section, but in particular, this quote. He says, "We also know that disc degeneration, ruptured discs, bulging discs, arthritis, and narrowed discs have been clearly shown to not be the source of chronic back pain." Thank you for some common sense, man. I mean, I have been waiting for the medical field to have an awakening, and at least this guy does. Reason number two, he says, increased risk of more pain after surgery. That's the reason to avoid surgery, because there is increased risk of more pain after surgery. Obviously, people having spinal surgery want less pain, right? So you can easily see the issue here. He says, if you're already having chronic pain elsewhere, totally unrelated to the surgical issue, you're going to develop chronic pain at the new surgical site up to 60% of the time. I mean, so you're already starting behind the 8 ball. It just makes no sense with an outcome. 60% of the time, you're going to have chronic pain at the new spot. And all I got to say about that is 2 syllables, 1 word, damn. But that ties in so nicely with the neurology I've learned in the DACO program. When your central nervous system is already hypersensitized or upregulated, it makes sense that new insult is going to behave like that. He also says that reoperation rates within the first year are as high as 20%. 20% within the first year have to get another surgery. And I mean, just as a side note, aren't you ecstatic that we don't have to deal with patients that have had failed spinal surgery from day to day in our offices? Failed surgery that we did? Good Lord. The surgeons can have that. I don't want it. And I don't care what they get paid. I don't think there's enough money to make me want that. Now, reason number 3, to avoid back surgery. Other treatment options are more effective. Again, hallelujah. This guy he's checking all my boxes, man. All my boxes. Praise the Lord. He ties in the new findings in neurology for chronic pain. So the stuff I've been telling you about the DACO program, I've been learning about hypersensitization, upregulation of the central nervous system, all of these things. That's what he is talking about. So he says, quote, "Your brain memorizes pain just like an athlete, an artist, or musician learns his or her skill." End quote. Now, For me, the best example of that is phantom limb pain. Think about that. There's no limb, but the pain persists, right? Because it's imprinted on the brain. So I'm hoping that in your mind, when I just said the pain persists, right? I'm hoping that in your head you agreed with me. You said, right, yeah, that's exactly right. I'm hoping that's what you said to yourself. So he says that once a patient understands the neurological nature of chronic pain, it becomes solvable. And the key is to shift off the painful and unpleasant circuits onto functional and enjoyable ones, or create detours around them and basically rewire the brain to an extent. I cannot encourage you all enough to read this article. Again, I've linked it in the show notes. It's on our Facebook page, Chiropractic Forward public Facebook page. Just go and check it out. Give it a read. Now, on to our next paper. This is item number 3. Chiropractic used in infants and pediatrics has become quite the hot topic recently, especially with the government in Australia looking at restricting any chiropractic treatment to the point where it may not be able to be utilized in patients under the age of 12 years old, if I remember correctly. In addition, this is expected to be spreading, and it kind of already is. If my information is right, it's already looking to head that way in British Columbia as well as Ontario. So it's worth paying attention to, folks, especially if you're seeing kiddos. My first advice would be this. And now listen up and have an open mind, okay? If you want to film your adjustments and put them on the interwebs, then go for it. But when it comes to hanging newborns upside down and performing manipulations on them that make them cry out and scream and things of that nature, here's what I would say. I would encourage you to do your fellow pediatric chiropractors a favor and not put those particular videos on the internet. Not because I think you're wrong. I don't mess with babies myself, but that's because I'm not trained in it, and honestly, I'm uncomfortable with it. But that doesn't mean I think it's wrong either. Okay, so regardless, it doesn't matter what I think. It's not about right or wrong as much as it is about perception, particularly the perception by people that don't know anything about or don't understand chiropractic at all, especially those that are ignorant, but then they're also in a seat of power and influence. So they don't know a thing about chiropractic, yet they have power or influence over how chiropractors practice. Bad combination. You don't want to take a drink out of that moonshine. Just don't freaking post those videos. That's all I'm saying, okay? I mean, it's common sense. If you want to be hardheads about it and keep putting that crap on the internet, you're going to run your fellow pediatric chiropractors out of business. And I just think that's a given. So please, stop it. With all that in mind, let's get going with this paper. It's called Manual Therapy for the Pediatric Population, a Systematic Review, authored by Carol Prevost, Brian Gleberzon, Beth Carlio, and probably others that are hard to say. It was published in BMC Complementary and Alternative Medicine on the 24th of July, 2018. Now, remember, the research hierarchy pyramid, okay? Remember, I already talked about it in this episode. And remember that this is a systematic review of 50 studies. So what they found moderate positive overall assessment was found for 3 conditions: low back pain, pulled elbow, and premature infants. Inconclusive, unfavorable outcomes were found for 2 conditions, which were scoliosis and torticollis. All other conditions, overall assessments were either inconclusive, favorable, or unclear. Now, adverse events were uncommonly reported. More robust clinical trials in this area of healthcare are needed. Amen, they are needed. Now, this next paper is called Utilization of Chiropractic Care in U.S. Children and Adolescents, a cross-sectional study of the 2012 National Health Interview Survey. This one was authored by Dr. Trent Peng et al., and Dr. Peng is also a member of our Chiropractic Forward private Facebook group. And I can't tell you enough, congratulations, Dr. Peng. Now, here's why they did it. The purpose of this study was to describe the prevalence of chiropractic utilization and examine socio-demographic characteristics associated with utilization in a representative sample of U.S. children and adolescents aged 4 to 17 years. How they did it, they analyzed data from 9,734 respondents to the 2012 National Health Interview Survey and chiropractic utilization in the past 12 months. In the past year was the targeted outcome. And here's what they found. They found that the 12-month prevalence of chiropractic utilization in U.S. children was only 3%. The adjusted odds with a 95% confidence interval, the adjusted odds of chiropractic utilization were higher among 11 to 17-year-olds. That's when they really get active in sports, right? That's just to give you an idea of how underserved the younger population is. 3%. That's terrible, honestly. Last thing. The last paper we're going to cover here is titled Change in Young People's Spine Pain Following Chiropractic Care at a Publicly Funded Healthcare Facility in Canada. It was authored by Christian Manansala, Stephen Passmore, Katie Pullman, and others. And it was published in Complementary Therapies in Clinical Practice online on March 16th, 2019. Brand new.
Hot stuff coming up.
And congratulations to Katie Pullman, who is with Parker University and is also a member of the Texas Chiropractors Facebook page. Congratulations, Katie. I want y'all to notice that that's 5 articles in this episode. We're getting some serious schooling right here, people. The reason for this one was knowing that spinal pain in young people has been established as a risk factor for pain later in life, and considering the fact that recent guidelines recommend spinal manipulation and other modalities for back pain, the authors wanted to begin exploring the response to chiropractic treatment in young people with spinal pain. Now, we already know it helps all of us old people, right? But what about the kiddos? It's all about the children. The study utilized a retrospective analysis of prospectively collected quality assurance data attained from the Mount Carmel Clinic Chiropractic Program database. I didn't know that existed. Okay, just between me and you. Don't tell anybody. And here's what they found. Young people 10 to 24 years old showed statistically and clinically significant improvement on the numeric scale in all 4 spinal regions following chiropractic management. Heck yeah, they did. I mean, really.
Bam, 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 blam!
The official conclusions read as follows. Open quote, the findings of the present study provide evidence that a pragmatic course of chiropractic care, including spinal manipulation, mobilization, soft tissue therapy, acupuncture, and other modalities within the chiropractic scope of practice are a viable conservative pain management treatment option for young people. Of course, for us, that's sort of a duh sort of thing, but until it's written in research, you can't treat it as a duh thing. While we think it's an obvious conclusion, it's not so obvious to others. So thanks to these fine folks for doing the hard work and allowing all of us to stand on the shoulders of your efforts. We appreciate it. This week, I want you to go forward with this. Number 1, big-time research and medical journals keep proving that you made the right decision to be a chiropractor. I know you didn't need the validation personally, but professionally, it's a hell of a nice thing to have in your back pocket. Number 2, chronic back pain will never be cured by a surgery-first mentality, and we knew that. But our central nervous system plays as much a part in the resolution of our pain, especially chronic pain, as any mechanical factor could ever play a part in it. Number 3, pediatrics is under attack. Stop filming what you do and putting it on the damn internet. You're not wrong. But perception plays as much a part in the problems pediatric chiropractors are having as does anything else. We get results in kids too, but if you don't watch it, it's going to get taken away from you. So just be smart. And the message, as with every other week we do this, I want you to know with absolute certainty that when chiropractic is at its best, you can't beat the risk versus reward ratio, because spinal pain is primarily a movement-related pain and typically responds better to movement-related treatment instead of chemical treatments like pills and shots. And when compared to the traditional medical model, research and clinical experience show that many patients get good or excellent results through chiropractic for headaches, neck pain, back, joint pain, all kinds of stuff. Chiropractic care is safe and cost-effective. It can decrease instances of surgery and disability. Chiropractors normally do this through conservative, non-surgical means with minimal time requirements and hassle on the part of the patient. And if the patient develops a preventative mindset going forward from initial recovery, chiropractors can usually keep it that way while raising the general overall level of health of the patient. Here's the key point. If you don't remember anything else, I hope you remember the whole damn thing, but if you don't remember anything else, here's a key point that you can put in your hat and smoke. Patients should have the guarantee of having the best treatment offering the least harm. And that's chiropractic, people. Now, send us an email at dr.williams@chiropracticforward.com and let us know what you think of the show. Tell us your suggestions for future episodes. Feedback and constructive criticism, you know what? It's a blessing. So subscribes, excellent reviews, iTunes reviews, other podcast services. Y'all know how it works, man. If you like something and you want more of it, well, you have to interact with it. You gotta review it. You gotta share it with your friends and your network. So help us get to the top of the podcast in our industry, because that would be super double awesome. We can't wait to connect with you again next week from the Chiropractic Forward podcast flight deck. This is Dr. Jeff Williams saying upward, onward, and forward. Be sure to find me on social media sites such as Facebook, Twitter, LinkedIn, and YouTube. While you're at it, give us a thumbs up on YouTube. That's super simple. Be sure and visit chiropracticforward.com. Give our podcast a listen. Lots of wonderful, wonderful information there. And as always, thanks for listening. We'll see you next time.